For this final cardiology countdown of 2010, we wanted to pick out the top 10 studies that will impact clinical care that the Cardiosource editorial board has come up with. So beginning at the number 10 spot, we picked out the Simplicity 2 study that looked at a fascinating ablation procedure of the renal artery to denervate it for patients with refractory hypertension. Not approved in the United States, but of great interest as an evolving therapy for hard-to-treat hypertension. The number 9 spot, we picked the RAFT trial that showed benefit of the CRT therapy for patients with mild heart failure. And this is one of a series of studies showing clinical benefit with mortality reduction of cardiac resynchronization therapy. And so ever-expanding benefit. At the number 8 spot, we picked a study. I presented the DEFINE trial that looked at a CETP inhibitor that raises HDL by 138%, anacetrapib, and it also lowered LDL by about 40%. This is beginning a large phase 3 trial, but so far has looked safe and thus a promising future avenue for lipid therapy. We put at the number 7 spot the ACCORD trial. The most recent component was the blood pressure target part of the study, where there was not a significant benefit on overall cardiovascular death and Meyer stroke for a more aggressive target of systolic less than 120 as compared to less than 140. There was a lower risk of stroke, and so this has helped clarify a little bit whether we need to be very intensive on blood pressure lowering or not. Then at the number 6 spot, and it was almost among the top 5, was the Cure Active Genetics sub-study. And this was the first to look at the cytochrome 2C19 genetic polymorphisms and clinical benefit. And interestingly, they found no difference in the benefit of clopidogrel versus placebo in those who had reduced function enzymes for the 2C19 allele or those who had normal enzymes. And so this pointed out that while the genetic polymorphism may be a factor, there are many others, and so there wasn't a significant difference in clinical benefit seen in that study. So moving into the top 5, we have the PLATO trial that looked at the new P2Y12 inhibitor ticagrelor, and this showed a clinical benefit of 16%, including a reduction in mortality relative to clopidogrel in patients with ACS. This was just approved for use in the European Union and is still under review by FDA currently. At the number 4 spot is the COGENT trial, a long-awaited study of randomized comparison of adding the proton pump inhibitor omeprazole to clopidogrel as compared with clopidogrel alone. In this study, no increase in cardiovascular events was seen, and that helped allay some concerns about cardiovascular risk. But a huge benefit was seen, a more than 2/3 reduction in the risk of GI ulcer or GI bleeding, and as such a big benefit of adding a proton pump inhibitor. At the number 3 spot, we have the EMPhASIS HF study that looked at eplerenone, an aldactone or aldosterone receptor antagonist, that was shown to reduce mortality in patients with mild heart failure. Again, a class 2 heart failure patient population with a huge benefit. And so this too shows an ever-expanding list of indications for aldosterone blockade and hopefully will help increase its use clinically. At the number 2 spot is the PARTNER trial, and this was the first randomized comparison of the new transcatheter aortic valve implantation that showed a big benefit in patients with severe aortic stenosis who are not operative candidates, and this was compared with medical therapy. It really opens the door to a whole range of new patients who could benefit from valve replacement, in this case percutaneously. It's again not FDA approved, but there are ongoing studies and a big benefit overall. And then finally, another long-awaited area, the RELY trial showed a benefit of the new anticoagulant dabigatran as compared with warfarin for prevention of stroke or embolism in patients with atrial fibrillation. Here, a reduction in the risk of stroke or embolism was seen with no increase in bleeding and a significant reduction in intracranial hemorrhage. And this is at the 150 milligram twice-a-day dose. Lower doses were studied and shown to be equivalent with lower risk of bleeding and approved for use in Europe. As such, a big advance as compared with warfarin. Other studies have recently been presented. The ROCKET AF study looked at apixaban and others ongoing. And so a new era of anticoagulation in atrial fibrillation and other indications has now entered. And so with that, a long cardiology countdown with a lot of terrific new studies that will really positively impact our care for cardiovascular patients. I'm Chris Cannon for CardioSource Video News.